Welcome to Cumberland Family Academy's Coffee Conversations. We use this platform to provide timely information to the families of Cumberland County Schools students. During each episode, we discuss timely topics and chat with district and community leaders who share important info with you, our viewers. Grab some coffee and join us for a conversation, a coffee conversation.
Hello, I'm Lindsay Whitley, the Associate Superintendent for Communications and Community Engagement with Cumberland County Schools. Welcome to Cumberland Family Academy's Coffee Conversations. We use this platform to provide timely information to the families of Cumberland County Schools students. During each episode, we discuss timely topics and chat with district and community leaders who share important information with you, our viewers. Today, we will be sharing updates on COVID-19 guidance and keeping you informed on where we are at in the global pandemic. I'm extremely excited to welcome our very, very special guest today, Dr. Jennifer Green, Health Director at the Cumberland County Department of Public Health, as well as our very own Shirley Bolden, Director of Health Services for Cumberland County Schools. Welcome, ladies. Thank you for being here.
Thank you for having us.
Okay, so first of all, Dr. Green, the first question is for you. So it's been almost 2 years since we really began to experience the effects of COVID-19 from a public health perspective. Where are we at with this global pandemic? Some people are wondering, is it over yet? Or are we at least moving in the right direction in terms of our COVID-19 metrics?
So that's a great question. I don't think the pandemic is over yet. I think we are turning a corner into a new phase of this pandemic, one that we hope can bring us back to some level of normalcy. But our metrics are improving, but not quite where we would like them to be, such that the World Health Organization has declared that the pandemic is over. But we are turning a corner into a new place and a new shift for spring of 2020. And we're working together closely, of course, with school district staff to chart that path forward.
Excellent. So in terms of the guidance, we hear there have been many updates in terms of the COVID-19 guidance. What does that mean for the general public? Is there a new variant? Is the current variant easing up? Just give us any updates on current COVID-19 guidance.
Yeah, so we do have a new variant. It is really actually what we call a subvariant of our Omicron variant. And so what we know about it, and the data is still coming in, is that this new variant or this new subvariant, which we call BA2 or the stealth variant, seems to be more contagious than the Omicron variant, which was, if you'll remember, more contagious or more transmissible than even our Delta variant. And so we're working with our state health officials and our partners, frankly, worldwide, to continue to monitor this. It's circulating at low levels right now across the United States and including in North Carolina. So that's one to watch. It seems and it appears as if our vaccines are going to be as effective against this new stealth variant or BA2 as Omicron, but it's really a bit early to tell and have some really strong data points on that for now, but we're continuing to monitor that and we'll certainly monitor our metrics.
Excellent. So with this new variant, and I'm sure there are some folks at home that are wondering, what are the current protocols that I should be taking, maybe as a student, as a parent, as a middle-aged person, as an older person? Can you just tell us what guidance should we be following at this time?
Well, as I mentioned, we're sort of shifting into this new phase of the pandemic where we want to think about what's good for you as an individual, but what's also right and going to benefit the public as a whole. So the first and most, I think, important guidance that for everybody that is eligible, and that's everybody age 5 and older, to get vaccinated. That is a key piece to continuing the decline in our metrics. So if you are eligible, if you're over the age of 5, mom, dad, grandma, aunt, uncle, It's not too late to get vaccinated. And if you are already vaccinated, get boosted. It's important that our individuals, especially our older adults, get vaccinated. If you're immune compromised, we need you to get vaccinated. And actually, if you are immune compromised, in some instances, you are going to be eligible to receive 4 doses of your COVID vaccine. And that guidance has shifted over the last couple of weeks. And so you can go to Cumberland County NC.gov, and we have a nice chart on our page about when you can get vaccinated. But the important thing right now is to remember vaccinations and to get boosted. For our other folks, and I know we're going to get into this in a few minutes about masking, but as we shift and kind of chart this new course, it's going to be important for some of our key groups to continue to wear their mask, particularly if you are high risk, if you are high risk for severe illness, or if you're immune compromised, or if you're not up to date on those vaccinations. We want you to continue to wear a mask while we try to get our numbers down even further than they are now. And what we mean by up to date is if you are not yet vaccinated, then you're not yet up to date. And if you are not yet boosted and you're eligible to get a booster shot, then you're not up to date. And for those folks, we want you to continue to add those layers of protection until you get an opportunity to get your booster shot or to get vaccinated.
All right, thank you. So parents, families, you hear there's still so much that we can do to protect ourselves and our family members. We're still in the middle of a global pandemic. We're turning the curve, but there's still a part that we need to do to keep everyone safe. So thank you so much for that updated information, Dr. Green. Now, Mrs. Bolden, we know that our school board recently voted to make wearing masks optional for students and staff. So what does that mean for our school system? Have other precautions changed or other things still in place? Just tell us a little bit of, unpack that just a little bit for us. What does that mean, mask optional?
Okay, mask optional means that you have the choice whether you're to don a mask or not. So if you come in and you want your child to wear a mask, they're not going to be penalized. If your child elects not to wear a mask, they won't be penalized. We do encourage everyone who tests positive or symptomatic to wear a mask for 10 days. We want them to consider masking just to decrease the risk of spreading the virus to other people. Again, in a voluntary setting, it is the choice of the employee or the family as far as the parent guardian if their children wear masks.
Now, there was a part about public transportation. So students that are still riding on our school buses, can you tell us about the guidance for that?
Yes, so if your child is taking driver's ed, if your child is being transported in a van for nursing services, if they are on any public bus, athletics, the adults and the students must be masked the entire ride. That is not optional.
So Dr. Green, I know that there are some times following a positive COVID diagnosis that an individual may be required to wear a mask. Can you share more information on that?
Yes, absolutely. So we still want our students and our teachers and our staff to be protected after they come back, after isolating, after a COVID positive test. So if you test positive for COVID, you're going to do your 5 days of isolation, or if you're symptomatic. And then when you come back on days 6 through 10, masks are still required on days 6 through 10. And that's to add that extra protection. We know the risk of infection still exists, and although it is much lower during those days, we want to make sure that we're protecting others in the classroom. So masks, if you test positive for COVID on day 6 through 10, masks are required. We recommend masking after an exposure. So if you're notified of an exposure in your classroom or on your athletic team or in your extracurricular activity, we recommend that you wear a mask for 10 days after your exposure.
Now back to you, Mrs. Bolden. When we think about where we're at in the pandemic in terms of COVID-19 metrics, are we moving in the right direction?
Yes, as a district, we're beginning to see our numbers decline. Let's take a look back for the last 3 weeks. So like the week of January 28th through February 3rd, we had like 523 positives and 375 exposed. February 4th through the 10th, we had 321 positive and 218 exposed. So you see where we're starting to show the decline. And then the week of February 11th through the 17th, we had 91 positive and 59 exposed, which that's still a lot of people to be to test positive or to be exposed. So we have to, again, adhere to all of our mitigation strategies to ensure that we're staying safe and that we're protecting our other fellow community members and school members.
Now, I know earlier Dr. Green shared some tips for us, some safety precautions, if you will, that we can still take, even though we've moved more to mask optional. Will you share some things with us, Mrs. Bolden, just some common sense, easy things that parents may consider in terms of safety measures? You know, some families may be concerned about mask optional, and they may want to know, what should I be doing when I send my young people to school? Do you have any tips that you can share today?
Sure, I'll tell you some of the things that we're doing in the school that you can even replicate at home. So of course, we're encouraging hand washing, covering your cough. We want to also remind folks that we have screening testing available. We're encouraging physical distancing to the greatest extent possible. Voluntary masking is always important, especially if you have someone at home who is immunocompromised or higher risk. We're encouraging virtual meetings in our building. So we're trying to meet virtually as much as we can. We have regular cleaning of all of our high touch surfaces and objects, and that's something you can do at home as well. We have an isolation room. If you have someone in our schools who have an isolation room, you can actually replicate that at home. If you have someone who's not well, you can set up an isolation room in your home where that person remains, and you deliver food to their door, and hopefully it's a room that has their own bathroom so that you can try to keep the rest of your family safe. And another thing that we're doing is we have signage promoting good health behaviors. And those good health behaviors will help us to prevent the spread of COVID-19.
All right. Well, thank you for that great information. Dr. Green, anything else to add to that list of precautions, things that parents and families can think about in terms of keeping their families safe?
I think you did a great job. Those were the things that I was going over in my head. I think the other thing to be aware of, please participate in that screening testing. You can also continue to order your 4 free test kits for your home from the federal government. That's at covidtest.gov, and test is. You can also go to the Cumberland County NC.gov website, and we have a list of test sites that we have available. So we'd encourage parents to take the opportunity to get tested if your children are symptomatic or if you work in a high-risk setting. So to continue to utilize those testing opportunities.
All right. So thank you, families. You're watching. This is great information. If you're just joining us, these are some very important COVID-19 updates. I encourage you, if you have not been able to watch this program in its entirety, please go and watch it from the very beginning. There are a lot of important tips and information that these two ladies have shared with us. And so now, Dr. Green, earlier, we talked a little bit about how we're relaxing the masking guidelines. However, the COVID-19 vaccines are still very important. So for those who are just now tuning in, can you please just tell us about the vaccines once again and who is eligible to receive them?
So everyone ages 5 and older is eligible to receive a COVID-19 vaccine. So we need our parents, our grandparents, our guardians, our teachers, our staff, everybody to take the opportunity to go get vaccinated. You can go to CumberlandCountyNC.gov. We have a number of community outreach test sites, including those, or vaccine sites, including those that are on the weekend. I want parents to take out your phone right now and schedule some time. I know that it can be hard to find time in a busy day to do that, but find some time to go do that. You can do that here at the health department Monday through Friday, 9 a.m. to 4 p.m. You do not need an appointment to go do that. So vaccinations is really key to this. And the second piece is if you have not received your booster shot and you are eligible to do so, we want you to get boosted. That's really been the key at preventing those hospitalizations, that severe illness, those excess deaths. The booster shots are critical for that. And everybody ages 12 and older is eligible for a booster shot. For Pfizer, if you are 5 months past your Moderna or Pfizer, you can get your booster shot. So vaccines and boosters, those two things together are very critical at this moment in the pandemic as we kind of turn the corner here.
So we're navigating through this global pandemic, and we're relaxing, some of the guidelines in terms of masking, but there are still some things that we can do to keep our families safe. So we're talking about the COVID-19 vaccine, very important. We've also talked about testing today, COVID-19 testing options throughout Cumberland County. Just as a quick recap and reminder for our listeners, Mrs. Bolden and then Dr. Green, if you would just share with everyone the COVID-19 testing options available in Cumberland County.
For Cumberland County Schools, we have Mako testing that is available at least once a week in the school setting. And we're really excited about that. We really want parents, you can register at any time. The link is on the Cumberland County Schools webpage. We really want you to take advantage of that. There's no cost for your family. And we have found numerous people who are at work, who are at school, who are asymptomatic, but we're spreading the virus without even knowing. So we want you to really consider that, just the benefits of keeping your family safe and keeping our community safe and slowing the spread of COVID-19 here in Cumberland County.
And on the county side of that, we have approximately 40 different test sites through different providers throughout the community, if not more than that. Some of those are rapid test sites. Some of those are those PCR test sites that you can go and send off to a lab and get your results back in a couple of days. And so, again, we have a testing page on our website at cumberlandcountync.gov. And then our state health department also has a great COVID website that you can go to, and that's COVID19.ncdhhs.gov, COVID19.ncdhhs.gov. And you can click and type in your address and find a test site that's close to you with varying hours, evenings, and weekends. And so we'd encourage you to take advantage of that.
All right. Well, thank you so very much. As we wrap up today's coffee conversation, thank you, ladies, for sharing this wonderful information with us. Very informative for our families and community members. But before we close, is there anything else that you would like to share? We'll begin with Dr. Green and then wrap up with Mrs. Bolden.
Well, I'd be remiss if I didn't share a little bit about the treatment options. And so that's really a key component to us turning the corner, is that we have vaccinations now. We have treatment options, including those that are effective against Omicron. So if you are symptomatic, we want you to consider those treatment options. Those have been found to be effective to reduce your risk for hospitalization, for severe illness and death. And so, again, I'll give that state health department website that has a great resource and wealth of information about those treatment options, including a finder for how you can get treatment, and that's COVID19.ncdhhs.gov. So please take advantage of those. Remember, treatment is not a substitute for vaccination. So we still want you to get vaccinated, and that's our first line of defense.
Thank you so very much. All right, Mrs. Bolden. And we just want to remind families to screen. So before you send your child, we want you to do some home-based screening. And if your child presents with one of the COVID-19 symptoms, keep your child home. Follow up with your healthcare provider or go to one of our many testing sites. We have the same request of our staff. If you are symptomatic, we ask that you remain at home, follow up with your healthcare provider, or visit one of our testing sites, because our ultimate goal is to keep Cumberland County Schools open and safe for everyone. All right. Well, that ends another episode of Coffee Conversations. And I just want to take a moment to thank you, Dr. Green, and thank you, Mrs. Bolden. It has been almost 2 years, and I know that I don't even know the half
of the journey that it has been for both of you, but you have represented both of your organizations and our county very well. And I just want to say thank you for all that you have done and all that you will continue to do. And to our viewing audience, thank you for tuning in to this episode of Coffee Conversations. Have a great day.